Hello, in this video I would like to search something with you, and it this this practice hopefully will help our IELTS reading skills, and our topic is baby walker useful and healthy for babies, or it has this real serious disadvantages and possibly led babies to be damaged by baby walkers somehow. Okay, I will use just 10 minutes for that, and let's start the search, and I will use scientific sources to search that. Otherwise the other websites are not that reliable and they're mostly waste of time. So I almost finished my first minute. Let's start. Baby walker. Okay, so I want to look at topics in general. Baby walker related injuries, another one. Convertible baby walker and gym baby walker related injuries, another search. Another patent which is not related. So someone is really trying to prove that baby walkers, as we see, there are more patents than research. And by the way, it is quite hard to make research on babies. Doing research on babies is not easy because you got to get permission from families and ethic committees, so it is not an easy task, even it is not harmful for babies. Okay, so I want to use 3 minutes or 2 minutes for research in general. Chronic subdural hematoma. By the way, I'm not gonna advise anything whether you use or not. I'm not a physician. I'm just aiming to read and study together. Okay, another patent. So sounds like it is easy to get a patent on baby walkers, so it is useful information for you. Just develop some baby walker patent. Oh god. Or Google think I'm quite interested in getting baby walker patent. You know, Google offer personal search results. Okay, that's enough to that. So let's start the first one. Okay, I'm not gonna read all full article. Okay, let's see. Objective: to describe the epidemiology of baby walker related injuries to children treated in a pediatric emergency department despite current prevention efforts, and to investigate the beliefs of parents regarding baby walker use. Okay, let's come to the result. I dislike reading that part, but actually sometimes methods are more important than research, because if they do it in wrong way, you know, the result is useless, so you're wasting time. But if it is a respectable search, it means the research mostly relied by other people, so you can just use that and you can believe the results. Okay, there were 271 children treated for baby walker related injuries. The mean age was, so the mean age is also important. What? Because it affects how they use baby walker. 62% of patients were boys. The number of stairs that a child fell down was significantly 96% of children were injured when they fell down stairs in their baby walker. It is quite important number. You know, it can possibly lead really serious problems. And 96 is, yeah. The number of stairs that a child fell down was significantly associated with skull fracture and admission to the hospital, and a fall down more than 10 stairs had a relative risk of skull fracture. Okay. So it means it is a serious problem. I'm not a physician, as I said, but sounds like not optimistic. There were 159 children with contusion abrasions, 58%. Ooh. 35 concussions, head injuries, and they use really, their sampling is not that much, but enough to understand the pictures. 33 lacerations, skull fractures, non-skull fractures. 3 of the skull fractures were depressed, and 3 also had accompanying intracranial hemorrhage. Okay, let's come to conclusion. 56% of parents favored a national ban on the sale of walkers, and 20% were opposed. Whoa. The interesting part is, you know, parents don't believe that they can manage baby walkers. I think they should. Okay, maybe it's not very usable. Despite the currently used prevention strategies, including adult supervision, warning labels, caregiver education programs, and stairway gates, seriously injuries associated with baby walkers continue to occur to young children. Okay. The manufacture and sale of mobile baby walkers that do not meet these new standards should be banned in the US. Okay. I think based on this article I can say that I would not buy a baby walker. Another one. But you have to be careful about the time. So the article published in 1997, these are not very new, so just okay, it's better. Let's choose that. I just have 2 more minutes. Come on, I have to decide in 10 minutes. Baby walkers are a consumer product frequently associated with infant injuries. Okay, come to conclusion. Governments should consider countermeasures such as prohibiting importation, sales, and advertising, together with public education and provision of stationary activity centers. Whoa! Effective education of professions, patients, the public, and I'm reading like Arabic. I'm starting from the last one. Okay, despite causing many injuries, including fatalities, baby walkers were perceived to be safe and used by nearly all families. Okay, sounds like okay, they did research in United Arab Emirates. The study population included grade 12 students. Okay, let's see whether someone think that it is good. I only have 1 minute. Oh god. Baby walker advantages. Come on. Okay, I'm not guilty. Google patents are guilty that they're all get my attention, make me lose my time. Okay, so as I can see, in general, I can say that baby walkers are not very good and can possibly cause injuries, and I think baby walkers shouldn't be in the public and not good for babies. Okay, so That is the end of my video. Have a nice